Welcome to Jas-Health for the people by the experts, a public health awareness initiative by Jaslok Hospital. I'm Jitendra Haryan, your host for the show. In today's episode, we will discuss about the bulging disc, which is the main culprit for the back pain, and many of us are unaware. To know more about its causes, symptoms, and treatment option, we have with us Dr. Manish Kothari, a renowned spine surgeon and a specialist in endoscopic spine surgery. Dr. Manish Kothari brings his rich experience in advanced techniques of spine surgery from UK. He offers non-operative as well as minimally invasive techniques for the treatment and early recovery of various spinal ailments. He has been instrumental in numerous national and international original research articles as well as book chapters. So welcome Dr. Manish to Jas-Health.
Thank you, sir.
Dr. Manish, commonly we read MRI reports mentioning bulging disc. Tell us more about it.
So to understand bulging disc, you need to understand what is the disc, right? So a human spine is made up of blocks of bones called vertebrae, and they are stacked up one upon the other like bricks in a wall. And the cementing part that connects one bone to the other is actually the disc. Now, disc gives movement to the body, flexibility to the body. It acts like shock absorbers like in your car. And it's a very flexible material. Unlike cement, it's a flexible material. Now, whatever moves in the body and whatever is under constant loading is going to undergo some amount of wear and tear. That is very natural. It is going to happen to every one of us. Disc bulge is when the discs start to undergo wear and tear. Now, what is the structure of the disc? The disc is like a jelly donut. It's hard outside and soft inside. It actually is like a jelly material at the center, what we call as nucleus pulposus. And the hard material outside is called as the annulus fibrosus. As we age, especially after age of 30, the annulus becomes a bit tougher and tougher. The hard part, annulus is the hard part, and the jelly material gets less and less. But it's a very slow, gradual process which the body kinds of adapts to and compensates. But when this happens quickly, where the body doesn't get time to adapt, or if there is a tear in the outer part, then all problems start happening. Now, bulging is when there is minor tears over a period of time and the outer part tends to spread out. It's like an old sofa foam that you've sat on it for many years and now has completely collapsed and spreading out. So that's a bulging disc.
So generally इसके reasons क्या है? ये क्यों होता है?
So one, it is part and parcel of normal aging. जैसे उम्र बढ़ेगी वैसे ये होना ही है सब में. ये कोई बीमारी नहीं है which we have to treat in everyone.
Okay.
बट जब ये आउट ऑफ नॉर्मल ह्यूमन कोर्स से चला जाता है और इफ इट इज़ कॉजिंग सिवियर पेन, then we need to treat it. Why does it happen? There are multiple factors to it. A majority of part of it is actually genetic, but that is not the only part. There are also environmental factors. How are we using the body? That also plays a very important role. It's like a machine. If you have a machine and how you use it, कितना लंबा चलेगा will depend on how good you maintain it and how good you take care of it. Now, what are the bad care of it? One is smoking. Smoking is known to reduce the blood supply to the disc. If you're a regular smoker, there's a very high chance you are going to have degenerative disc or ruptured disc very early in life. If you are overweight, so that is very easy to understand because overweight is more the weight on the spine and is going to go beyond the structural capacity of the spine. Third is poor posture. The spine is designed to bear weight in a certain posture. Now with our modern lifestyle, we are mostly sitting or we're sedentary. The muscles are not as strong as would be in a manual laborer. So there your discs are not as strong.
Or not protected well.
They're not as protected well. As in the muscles act like an internal support system for the spine.
Which holds the spine.
If the muscles are weak, then the loads on the spine can become eccentric. It can be asymmetric loading, which can cause tears. So as I said, the spine is designed to take weight in a certain manner. If you don't follow that manner, there is a very high chance you'll end up with tears and disc herniations.
So, are there any early warning signs that might indicate there is a development of a bulging disc?
Yes, there are. So first is that not all bulging disc will cause any kind of symptoms. It is not necessary that a bulging disc will cause pain. But those that cause
So,
pain,
कितना % लोगों में ऐसा होगा कि उनको पेन ही नहीं होगा?
majority, more than 95, 98, there is no number to it, we don't actually know, but I can very easily say that majority will not have pain. It is only those who have.
So, कोई भी आम आदमी अगर MRI करेगा तो mostly he should not be surprised that कि there is a bulging disc.
हाँ, माने for a person who has no pain, जिसको कोई तकलीफ ही नहीं है, वो भी MRI करेगा तो हो सकता है उसमें कुछ bulging disc दिखे, which is considered as part and parcel of normal human aging.
Aging process.
उसे disease का label नहीं लगाना चाहिए. We should rather encourage good habits. माने वो व्यक्ति अगर जाके MRI करा रहा है, माने वो he has some concerns regarding his back, तो we should encourage good habits, not label it as a disease.
So preventive MRI भी करने की कोई ज़रूरत नहीं है, just to know if you
Definitely
have
not, because अगर मैं मान लो इस रूम में से मैं 10 लोग को MRI करता हूँ, 9 out of 10 most likely will have some bulging disc. So we do not encourage preventive MRI because it will open up unnecessary findings. MRI is an oversensitive test. It should be done only when there is an indication to do it जब ज़रूरत है करने की.
So doctor, you mentioned that posture plays a big role, okay, in causing a disc bulge. So let's talk about it in detail. So पहले अपन working professionals के बारे में बात करते हैं. बहुत लोग ऑफिस में काम करते हैं, they sit for about 8 hours, 9 hours. What is your advice? I mean, what do you think in your observation उन लोग क्या गलत follow करते हैं और उन्हें क्या सही follow करना चाहिए as far as posture is concerned?
Correct. That's a superb question. We are now becoming more and more urban population.
Correct.
Physical activity बहुत कम है. So muscle strength overall in the general population is much less, especially in women. Now working professionals, more than 50% will be traveling long distances
Correct.
to reach work. तो उतना समय बैठना, that itself starts the process. You sit and travel. बहुत बार हम laptop bag होता है, so you carry only on one side. That again causes asymmetric loading of the spine. If it's a heavy bag, light bag है तो कोई difference नहीं है. Then शुरू होता है office में. Office में many people smoke. That's very common. I've seen in the corporate world. Second is how you sit on the chair. Now office में जाएंगे तो sitting ज़रूरी है. You will have to sit. You'll have to work on the computer. So we start with the sitting. Now sitting में बहुत बार होता है that you are sitting, say 2 hours, 3 hours at a stretch, you want to finish your work and you gradually slide in your chair. So something like this, you slide and your back goes forward. So what happens is your lumbar spine then becomes, instead of being in a normal curvature, which is what we call lordosis, goes into a straighter curvature or lesser lordosis. Now spine is designed to take weight in a normal lordotic fashion. If you are loading the spine in a straight spine or a kyphotic spine, which is the curvature is gone, then the disc pressure increases more than when you are even standing. To give you a rough idea, so when we stand, say the pressure on the disc is 100, just a rough value I'm giving, 100. When you sit, just plain sitting, even in a good posture, will increase the pressures by 125.
Oh really?
If you are sitting in a bad posture, that pressure will go to 175. If you are sitting and bending forward, that pressure goes to 225. So that the disc is not designed to take. If you are sitting for short duration, it will not make a difference. But if you are sitting hours and hours in the office in that bad posture, it will cause accelerated disc degeneration because of the asymmetric pressures on the disc. It is not designed to take that kind of weight.
So how should they sit then? What is the right way of
So the
sitting?
best way is to have a proper office chair whenever you are sitting, and your entire back should be supported. You have to have your entire back, so right from the buttock part, this part to your upper back, that has to be fully supported throughout the time you are sitting. You shouldn't slide in your chair forwards. Keep correcting the posture. It is bound to happen, but keep correcting your posture every time you slide down. Second is, if possible, always use a desktop rather than a laptop. If you have to use a laptop, then you have to have a laptop stand so that your gaze is straight, your vision is straight, you're not looking down into the laptop. Third is, you should not be reaching for your work desk. Your entire back should be relaxed, you're looking straight, and the computer is close to you. Arms fully relaxed. The
And
computer is
supported
close
by
to
the
arms
desk.
supported by the armrest, but
Yeah.
fully, it shouldn't be like this.
Yeah.
Should be fully relaxed. And you're working in this manner, but not bending forward and working in that manner. So that's a discipline that you develop over time. You have to keep a reminder on your work desk so that you keep correcting your posture. You're bound to slide down. You're bound to develop bad posture because it is relaxing for the muscle somewhat, but it is bad for the disc. I recommend generally every 45 minutes.
You should get up from your
Stand
chair.
up, stretch, take a
Small walk and
coffee
come back.
break, or just walk around, go take some fresh air and come back. Today's hectic lifestyle, it is not possible, but just stand at your place and work if you have to.
Let's talk about people who stay at home, especially housewives and also elderly people. And now I think this working from home also has become very common after COVID. So आप उनको क्या सलाह देंगे?
Yeah, so let's talk about the work from home. It's like a great modern innovation that people are enjoying, but it also is, taking a huge toll on the backs of the people. After discussing with a lot of people, especially after COVID, we've realized that work from home is very bad for the back because all the bad postures happen at home. You're half sleeping, half sitting, you're sitting on the floor, you're half on the chair. There is no discipline. You don't have to sit on the office chair gives you some kind of discipline to sit at a place and work, but at home that discipline is completely
Correct.
lost. So at home, not everybody has an office chair. So most people have that either dining table chairs or those plastic chairs. They don't have good backrest. They're not designed for longer sitting. So that adds to the problem. And people kind of think that adding a cushion here and there will make things better, but that's not the way to go ahead. It is your own posture that you have to maintain and erect good posture by using your muscles. That is what will help in the long run. For people using public transport, I would say that one, you always use a proper shoulder bag and you wear on both your sides. Don't wear on one side only. It should be on both your shoulders so that the weight bearing is symmetric on your back. Not many people get to sit. Many people come standing, which is in a way good. But if you're sitting for 2 hours, then reduce the sitting to about say an hour and get up after an hour or so and try to stand and come. That is better for your back overall. And if you have the luxury of sitting and standing, that is the best. But Bombay, I don't think that is possible. And the same principle of the back support is also valid in the car. Entire back has to be supported. You slide down gradually and then there is a gap. There's a triangle which forms behind your back. Between the backrest and your back, there is a gap that comes in. That should not come. You have to push yourself back. Put entire neck to your lower back should be supported.
So let's talk about kids now. So after COVID, I think they mostly shifted to these digital platforms. And these days, even, kids after a certain age, 12, 13, they think mobile phone is their right. And their, time spent on digital devices also has increased. So what is your advice to these kids and their parents?
But these are the times, and you have to go with the times. Children are bound to use mobile and all digital devices. How to reduce it is a separate topic. But if you have to use it, then make sure you don't give them small screens. Give them tablets rather than a mobile phone. If for all the schoolwork or watching classes on online classes and so on, and try to give them a proper work desk also, so that they sit and again it goes at the eye level. It should not be that they're sitting on the chair and or on the dining table and then looking down into the tablet. That is bound to cause neck pain amongst children. It has to be at a higher level. Buy whatever stand you have to buy. And also it reduces kind of accessibility to the child. If it is on a stand, they will not use it for other distractive purposes. They will stick to the class.
That's a good idea. So how does the body naturally compensate when the disc begins to bulge? And if ignored, what could be the long-term implications of that?
Yeah, so the disc is going to undergo some amount of wear and tear, and the body tries to compensate by toughening the annulus fibrosis, which is the outer harder part. That area becomes more and more, so that's like a healing process that goes on simultaneously. And sometimes we see the body forms extra bones in the vertebrae. That is what is on x-rays we commonly call as spondylosis. It's a very common term, everybody uses it, spondylosis, but that's a normal healing or a stabilizing part of the body. When there's a tear, the spine becomes minor, very micro unstable. So body forms extra bones, makes that part tough. That's what we call as osteophytes. So that's the process. Now, if this goes unchecked, you don't take corrective measures, the ligaments, the bones will overgrow than what the body wants. Once it overgrows, the spinal nerves are very close, or they're rather inside the spine. It's like a tunnel in the spine. So that space of the tunnel for the nerves becomes less and less and less. That's when the nerve pain will start coming in.
Right.
And that's a dangerous situation.
Yeah.
Nerve pains become a kind of serious matter. It will limit your overall lifestyle, will cause pain, it will not let you work, and all other things will kind of come in.
If someone is diagnosed with a bulging disc and is causing pain, first, as a spine surgeon, what would you advise that person to do so that that problem doesn't aggravate?
So first we kind of go into the details. Why is this happening? So if the person is a smoker, overweight, poor posture, very sedentary lifestyle, no activity at all, so all those things one by one are identified and corrected. The patient is encouraged that you do this and you will be fine. Second is exercises. So we've corrected the posture and everything, but you also have to do a certain amount of exercises for the back specifically. Now, across the world, research has shown what exercises you do does not matter as long as you do some exercise every day. The discipline is more important than the type of exercises you do, be it yoga, Pilates, Zumba, Surya Namaskar, whatever you want to do, but please do.
So specific core strengthening exercises, they are also recommended for spine health?
Yeah, so core, basically what is core? Core is all the muscles which surround the trunk of the body. So these muscles have to become strong. That is what is core strengthening. Now this can be done in all of these type of exercises. There are planks, there are yogas, Surya Namaskar, Zumbas, Pilates, as we said. They all do the same thing. What works for you, what you enjoy, because these exercises are boring. You ask anyone to do these exercises every day, he'll do it for a month and then stop doing it. These are boring. You have to find what you enjoy and keep doing it.
Yeah, you should fall in love with it. Dr. Manish, let's talk about techniques in spine surgery now. And you being an expert in endoscopic spine surgery, tell us more about it.
Right. So first and foremost, I want to say that not everybody needs surgery. More than 99% of the patients I see are treated without surgery. It's only the ones which are severe, where there is damage to the nerves or where there is damage to the life of the person, where he cannot work, he's unable to go to work at all. There we can do endoscopic surgeries and change the nature of the problem that is going on. What is endoscopy? Is like a small pen-like a structure. It's the diameter of a pen that goes inside the body, and
a small hole,
basically a keyhole, smaller than a keyhole, and that goes inside the body, and we have all our lasers and all our instruments that can go through the scope inside the body, free the nerve, treat the bulging disc, and then the patient gets better quickly, and we prevent nerve damage where required.
And he can have his normal life after that.
Yes, most of them, yes, we can have normal life. There is a very common myth that you can't live an active life after spine surgery. We've had lots of patients who've ran marathons, doing active gymming, who are singers, who are doing stage shows, 4 hours stage shows, running, dancing. So all that active life is possible, provided your nerves are free, which we do either by physiotherapy or surgery, and you do your core exercises regularly.
Yeah, I think that's very important. So now spine-related pain or issues are quite painful, but there is some humor in the way people also deal with it. So, and I'm sure you must have dealt with many such cases. You want to share any particular case?
We had one patient who insisted to the physiotherapist that I have back pain and you have to stand on my back then I will get better. I don't know how the physiotherapist accepted it, but she did. And she stood on the back of the patient, and he had an acute tear in the disc, severe nerve pain. He had to be hospitalized and operated to free the nerve, and he got better. But this was completely bizarre.
So, what is your advice to the youngsters, especially, so that, they protect their spine well and, they don't have bulging disc related issues, especially painful ones?
So, especially the youngsters, the young office goers who've just joined the workforce, 20s to 30s. In those 20s to 30s, the age group, the pain is very minor. It just starts coming in. It becomes major if it goes unchecked in the 30s generally. So the people, especially in their 20s, one, don't smoke, please, even if there is peer pressure. Two is keep yourself active, do regular exercises. There is a lot of work pressure. Young people are generally the younger, lower in the hierarchy of the corporation. But please make time for yourself. Instead of going out to a pub, probably do some exercises once in a while. That will take you the long way.
So, doctor, जिनको bulging disc की समस्या है, उनको running, वेट लिफ्टिंग या स्विमिंग जैसी फिजिकल एक्टिविटी करते वक्त क्या खास ध्यान रखना चाहिए?
Right. So they are absolutely safe, but it has to be in the right manner. Let's take each activity one by one. So say if you are running. Running actually has been shown to improve disc health. Whenever there is impact on the disc, low level impact, that improves disc nutrition. There are some studies which have shown that running at the speed of around 7 is the best for disc health. So of course, but I'm assuming you have good quality shoes. The impact on the spine is kind of dampened. But just the speed wise, if you're running at around 7, that is known to improve disc health. And why is that? The disc is like a sponge material. It needs nutrition. It doesn't have direct blood supply, but it takes the nutrition from the bone above and below. For the nutrition to happen, the disc has to be compressed a little and opened a little, compressed a little, opened a little. So that happens on low impact activities, or any simple walking also is going to have that kind of effect. But if you are say sitting continuously, then that is only compressed, it is not opening up. So this blood supply is completely cut off. The nutrition is completely cut off to the disc. Or on the other hand, if you are running at high impact and you already have a slip disc or a disc herniation, then that can worsen. So running at around speeds of 7 with good shoes on a good surface will improve your disc health. Let's come to weightlifting. So low amount of weightlifting will keep your muscles healthy. Assuming you do it in a proper fashion under the guidance of a trainer or a physiotherapist, then your muscle health will also improve your disc health. But of course, not heavy weights. Heavy weights is a very subjective matter, but for every routine person, average person, lifting mild to moderate weights is beneficial to your spinal health. Coming to swimming. Swimming is of course great for the back and neck both, but if you have a slip disc or a disc herniation and you know to swim, then it is all right. But if you are learning to swim, then I would say no. Let it settle down, let your back heal completely, and then it can be taken at a later stage when the back is completely pain-free.
So let's have some rapid fire questions, doctor. If your spine could talk, what would it say after a long day?
Please get your bums off the chair and walk around.
Doctor, what is the weirdest thing that someone has done to fix their back pain before coming to see you?
We've seen a lot of odd things happening. We've seen some people hammering, quacks hammering on the back, and apparently that is taking away the pain of the patients. I don't know how, but it's either psychological.
In villages, this is followed quite a bit.
In villages, it is followed. I've not seen it personally, but people have told me that they've got it done. And obviously the people coming to me have had worsened back pain.
So if your spine had a favorite sport, would it be yoga or gymnastics?
Again, I would say any sport is good for the back, be it yoga or gymnastics. But from the safety point of view, of course, yoga is far safer.
And if you could give one superpower to the spine, what would it be?
Never to degenerate.
Doctor, do you secretly enjoy cracking your own back?
It's a myth I would avoid. I don't do it myself, and I also advise people not to actively do it. because all the movements are sudden, jerky movements on the joints of the spine, and they can sometimes cause tears in the ligaments. So I would say avoid. Just stand up, do some stretches. That will give you more relief and will be safer for your back also.
Did you always wanted to become a doctor, or was it something else?
Well, I wanted to be an F1 racer,
Oh, that's quite interesting.
but life did not turn out the way I wanted it to be.
I'm sure I think you're happy doing what you're
I'm
doing.
I'm enjoying myself.
Thank you, Dr. Manish, for sharing your valuable insights on bulging disc today. Your expertise has truly helped us understand this condition better, from its causes to treatments. Today's episode will undoubtedly benefit our audience. Thank you once again.
Thank you so much for having me here. It was a pleasure talking to you. Jas-Health, for the people, by the experts, an initiative by Jaslok Hospital.
Click the subscribe button on YouTube to stay healthy and stay tuned to Just Health for the people by the experts by Jaslok Hospital.